Welcome, everybody, to the Cone of Shame Veterinary Podcast. I am your host, Dr. Roark. Guys, this is a fun one. I've got Dr. Simon Haeder here. He is an associate professor of public health at Ohio State University, and he's got some fun, cool research. It's just some little studies. There's secret shopper surveys where he had an army of students, of undergraduates, call vet clinics and try to make appointments with them. And then after they made appointments, he had them say, I don't believe in vaccines. Is that a problem? To see what they said. And that's the research, and that's what we talk about. And so we were talking about access to care. How hard is it to actually get into the clinic? We're comparing cities to rural areas. We're looking at different states. It's just a really neat conversation about sort of the state of care and how hard is it to get into the clinic. And then honestly, is that a problem? When does wait time for wellness care get to be an issue? And we talk about that stuff as well. And then the vaccine hesitancy stuff is really interesting. And so, I don't know, there's just nobody else doing research like this. There's some really cool ideas, I think. And then obviously a need for more research. But this will be a fun episode. You will enjoy it. It will make you think about the larger picture of healthcare, and specifically vet health care and wellness care. So anyway, guys, this is a good one for some brain food. Let's get into it.
This is your show. We're glad you're here. We want to help you in your veterinary career. Welcome to the Cone of Shame with Dr. Andy Roark.
Welcome to the podcast, Dr. Simon Haeder. Thanks for being here, my friend.
Thanks for having me again.
I so enjoyed having you on before. When you were on last time, you were talking about some of your research that you have done around vaccine hesitancy in pet owners. And I thought it was so interesting. I think you're such an interesting guy. You are an associate professor of public health at the Ohio State University. You, like me, are someone who gets bored quite easily. And so you work on a variety of different systems. I'm reading a lot of stuff from you that's not about pets. It's about access to care in rural communities for people. And the thing I want to talk to you about today is, again, you're just doing cool stuff and lots of it. I want to talk to you about the secret shopper survey that you ran in veterinary medicine. And just kind of how that came to be, and then I really want to get into the data because I think this is fascinating. Why don't you just lay down the secret shopper survey and kind of what it was and how you set up and sort of what your driving questions were?
Yeah, so I've been, as you mentioned, kind of all over the place because lots of different things in healthcare are super interesting. So I've been working on secret shopper surveys in the human field for, several years now. And I should mention that the Robert Johnson Foundation has generally funded this work and has the Department of Insurance in Pennsylvania. They, given us the money to do this kind of work. So I should mention them. But we've done this in the human field, and we wanted to know stuff like how accurate are provider directories for people? How long does it take for you to get an appointment? Those kind of things. As I was working on these topics, and as I've been really interested in pet care and veterinary care, I was curious, how does this look for vets? And how does it look for, getting your dog into care when you need it? That was kind of the starting point.
Quick summary. How is it generally for humans? Are they crushing it? Or are you just like, wow, super convenient to get in?
It's super bad. It's super bad all the time.
That's what I want there. Okay. That mirrors experiences I've had.
Yeah. And I think anecdotally, everyone knows, especially if you move, it's so hard to get an appointment for anything. And the work that we've done on the human side and continue to publish on is kind of like putting numbers to this, like hard numbers to show how bad it is. Felt like there was nothing there on the vet side. And I was like, let's do it. Yeah. Let's find this out. Grab some students, made 5,000 phone calls, which is quite a large number. 6 states, California, Minnesota, Ohio, Pennsylvania, Texas and Washington, kind of diverse and what they look like, size, populations, all those kind of things. And the first part of the project was really just like, hey, I have this dog, 15 weeks old. Can I get it into care if I need to? The first kind of big exam at 15, 16 weeks. And so we ran that. It was super interesting. We set it all up like realistic as can be, created fake but real home addresses, randomized the dog breeds across the most common breeds, randomized dog names, like all the stuff. So it looks really realistic. And we had my students search Google Maps to find the closest veterinary practice to their home, made the calls, and it looked surprisingly much better than the human side. And that was, I think, the biggest surprise that came out of it. There's a lot of nuance here. We looked at how can you get an appointment? How long does it take to an appointment? How long do you have to drive? Are there differences, rural, urban? across different states, all those kind of things. So there's a lot of stuff to unpack there.
There's a lot here. I think the elephant in the room, as soon as you laid this down for me, is did you see a difference in breed? Is it easier to get into and get an appointment if you have an English bulldog? Is it easier to get? They're like, I want this 15-week-old puppy because this is a practice builder versus something else. I mean, I don't know. Did you see? I was thinking about sort of the address, things like that. You're calling a lot of different practices. Surely there's a lot of baked in variability there. Were there sort of trends that you pulled out across these variables?
Yeah, I think so. So like, I was sorry to disappoint. We didn't check on the breed stuff. Some big differences were urban, rural. I mean, that's not surprising. Urban, harder to get an appointment, more driving time, those kind of things, not surprising. Quite substantial driving time. I don't think that surprises us. I should mention, we focus on preventive care here. Everything I say is focused on preventive care. Differences across states. Texas, you could generally get an appointment within 2 or 3 days. I found that was just startling to me. Places like Minnesota, it takes a little bit longer. Pennsylvania, 8 or 9 days on average. But you look on the human side, this is like outrageously good. That's the shocking part. Also, the proportion of calls that actually led to appointments, surprisingly high. 2 out of 3 calls actually got you into an appointment. On the human side, sometimes that's as low as 20%. So you're like strikingly good again. Average driving times are like 11 minutes or so. Again, compared to the human side, excellent, like unbelievably good.
That definitely makes me feel good. What was the state that generally took the longest to get into?
Minnesota was a bit hard on the driving time, and Pennsylvania, I think, was a little bit hard on the days to appointment.
Okay. And then what does good look like, Simon? You sort of threw out some numbers, but for the most part, I think it seems like comparing to human medicine is probably not going to be particularly helpful because we're just dealing in an entirely different scale. What is good in your mind?
Looking at the paper right now, so the average wait time was 6.36 days, or the median was like 3 days, which is really, really good. Average travel time was 11 minutes or 6.4 miles. But again, some variation across states, rurality, those kind of things.
Yeah. And then it is interesting that it's easier to get in when you're rural than it is when you're urban.
No, it's a little bit harder, actually, the other way around. The rural part is a little bit harder and longer driving times. Where I thought, this makes an interesting contribution besides, like curiosity and all those kind of things. You've talked about this on your show quite a bit. Is like supply and demand in veterinary care. Do we need more veterinarians? What does it look like? There's a lot of nuance to that just debate, and lots of schools are coming online and all those kind of things. I think this kind of shows that, at least for preventive care in the places that we looked at, and lots of limitations, obviously, it looks pretty decent. That doesn't say anything about specialty care, those kind of things. And it does highlight the challenges that you've talked about on the show quite extensively. Is rural vets is quite a challenge, while the average access situation in veterinary care is probably pretty good in most places. Rurality is the big issue, and we got to find policy solutions, I think, to address those.
Do you have any ideas? How would you start to benchmark this? So, for example, if you said to me, Andy, on average, you can get into a vet clinic in 3 days for a wellness visit in the city, and it's 6 days in more rural areas. My thought would be, is 6 days a problem? Is it a problem to wait 6 days? Now, granted, I know if the trends hold for emergency care, you can't wait 6 days for your vomiting diarrhea dog. Like that makes sense to me. But again, I don't know. Do you have any idea of what constitutes a lack of access to care? What is that?
That's an excellent question. And I can tell you from the human side, where I've done most of my work, is states that try to regulate this, they kind of make up a number, and it's quite meaningless, I think, to most people. I think that's where really a stakeholder conversation between patients and providers kind of comes into this. And it's like, you're a veterinarian. What's an appropriate wait time for a preventive visit is probably, you can wait a little bit, but then it becomes like, hey, I don't more emergency kind of visits, like how long is bad and all those kind of things. I think that's where we ought to have these kind of discussions, but we don't even have them on the human side. So like,
Okay. Well, I don't know if that makes me feel better. In a way, I feel like we're off the hook a little bit. But yeah, that makes sense. When states sort of come up with arbitrary numbers, what's the order of magnitude on those numbers?
Yeah, California is one of those examples. So most states don't even regulate wait times or driving times. Federal government does it to a degree. Sometimes, for specialty care, it can be up to 75 miles. For human medical care on that side, in California, some of the wait times for primary care are like 10 to 15 days.
Okay.
It's compared to those, and I think that's where I found it reasonable, and compared to my experience from measuring these kind of things on the human side. It looks pretty good. It's hard to complain about those numbers.
Yeah,
you know?
I'm not looking for something to complain about. I'm just trying to get my head around, like, if I say it's good, is it good? If someone says, how do you know it's good, Andy? It's kind of, I wanted to sort of dig into that. You know, one of the things that you did with your sort of secret shopper surveys, you sort of combine these two interests, right, of access to care and sort of availability, and then also vaccine hesitancy. Can you talk about your vaccine calls?
Yeah, I mean, it's a fascinating issue on the human side and also on the pet side. So what we did, we leveraged as much as we could out of the data. And so we presented as someone seeking an appointment, got all the data on the appointment, and then we said, hey, by the way, half the people kind of said, like, we don't believe in vaccinations. We don't want our dog to be vaccinated. And we were trying to kind of record, how does the veterinary office respond to that?
So just to get this straight, so you called, and when you say the veterinary office, I'm assuming you're dealing with sort of front desk staff, people answering the phone. And then the students who were doing the call were just like, by the way, I don't want to vaccinate. Tell me more about sort of the methodology of that. Like, who did we deliver this message to? What was the grading rubric on their response? Like, how did you start to look at that stuff and sort of quantify what someone's reaction was?
Yeah, so again, we tried this on the human side first. Pediatrics is the go-to for these kind of things. And so we kind of mimic that again. So try to get the appointment so that data is, clean and valid on the, access to care measure. And then we're like, I don't think I want my dog to get vaccinated. I don't believe in that. We had like a little script put together that made sense and that we had tried out a few times. And then we're like, the phone call most likely goes to a front desk person. And then the big responses were like, okay, that's fine. About half of the veterinary office were completely fine with unvaccinated dogs. Okay. And about the other half were like, we at least want you to get the rabies vaccine. Like, that's where we kind of draw the line. That's kind of interesting.
Yeah, and that was sort of the pushback, is you were like, not a problem, or rabies is our line. Okay,
that's the line. Yeah,
I believe this trend is growing. I actually had a client today that had they wanted their pet vaccinated, their cat vaccinated with a specific vaccine, and they requested that we order that vaccine to give it to their pet. And so it's a point of discussion right now. But to have someone come in, it wasn't they didn't want to get vaccinated. It was that they did want to get vaccinated, but they had a specific brand preference that was strong enough that they were willing to say, you tell me what it costs to make this happen, but I want this brand. And I have never had that conversation before that I can remember of somebody being that informed, in whatever degree they were informed, but that serious of, this is how I want this done.
Yeah, that's fascinating to me. I think one of the general problems I think we have in veterinary care is like, we don't know enough. Like, there's not enough data to know these kind of things. Like, how frequent are these experiences? And so I think that's great opportunities, to learn more and to better understand what's happening in the world. My guess is this is going to get more frequent. Federal government is really pushing on the anti-vaccine stuff right now. Lots of concerns. The COVID stuff is in the news again from the FDA. So I think we're going to see more and more of those kind of problems coming to veterinary practices, and like, how are we going to respond from a veterinary side to this?
Are you starting to see any responses, either in terms of sort of vaccine hesitancy or just in availability, like we talked about getting people in? Are you starting to see any responses on the human side of healthcare that make you optimistic? Do you see some best practices? Do you see is there some group somewhere that's doing it really well? They have an abnormally short wait time to get in. Are there anything that you can look and say, groups that approach it this way, or healthcare providers that have taken these steps tend to see lower wait times? Is there any sort of correlation to their behaviors or policies?
So that's a good question. I think the biggest difference we see between humans and veterinary care, and that's changing a little bit too, is on the human side, most people have insurance. And if you have insurance, you have to go through your provider network. You don't want to go outside because the costs are massive usually. And we experience this kind of here at Ohio State. Our provider network is very narrow, very much focused on Ohio State doctors. And so like, I'll give you an example. I can get to the dermatologist down the street next week, or it's out of network, or I can go to the OSU dermatologist next September. These issues we don't quite face on the animal side. Although, as you know, and as you've talked about, pet insurance is growing. I think my understanding is it's mostly indemnity type insurance. So you go to a doctor and they can reimburse a certain percentage or a certain cost. The question is, are we, with the challenges that occur, like high cost, insurers dropping and canceling policies because of high costs, are we going to see more of a managed care approach in the pet side as well? Whereas like here's a subset of providers that we contract with. You have to go to those providers in order for the insurance to work. And so that's a big question. So generally speaking, it's hard to compare some of these things, but there are certainly some places that do the medicine side better than others. I'm just not sure if we can compare it apples to apples because big medical groups on the human side, small medical groups, even if there's more private equity coming in and all those kind of things. But lots of developments, as you know, kind of come over from the human side onto the vet side after a few years.
What are you most interested in following up on and kind of digging deeper into? Like, where are your big questions for the future?
Oh, that's a good question. The vaccine stuff is really important, and I'm going to continue to work on that. I have some interesting stuff that I'm going to continue to work on there. But I think the access to care part is something that's been neglected. We kind of know that costs are a problem. We kind of know that access to a degree can be a problem, especially for specialty care. My future work, I think, is going to focus on like, how can we create a system that's accessible to people, because people become more and more family members. There's some lawsuits that you've talked about, considering them close family members, and what does that mean? But if they're close family members, how can we get them into appropriate care as costs go up and as access becomes more challenging? And so, what does that mean for people in terms of making the choice or having to make choices about certain treatments because they can't afford the treatment that the veterinary would recommend? Like, how do we manage those kind of things? What does that mean for people? What does it do to their lives? I think that's where interesting questions are.
No, I think that's fascinating. Dr. Simon Haeder, thank you for being here. I always enjoy our conversations so much. Where can people find you online? Where can they keep up with your research?
Yeah, as always, you can find me on LinkedIn. That's where I post most of my work now. But you can Google me, and obviously my OSU webpage is also accessible.
I will link both of those things up. Thanks for being here, my friend. Guys, thanks for tuning in, everybody. Take care of yourselves, gang. We'll talk to you later. And that's what I got. Thanks to Simon for being here. Thanks to you guys for being here. Take care of yourselves, everybody. Be well.